diet and nutrition for diabetic patients. The first one, I invite the chairpersons, Dr. Anita Gautam and Dr. Shikra Mathur, to please take their respective chairs. Come as chairperson. The topic to be covered by Dr. Poorvi Chawla is time-restricted eating and calorie restriction, a very important part of diabetic patients' management. I hand over to the chairpersons to kindly introduce the speaker and invite the speaker.
Good morning to one and all present here.
Thank you so much. First of all, I think I should. So time-restricted eating versus calories restriction. I'm going to refer throughout to time-restricted eating as TRE and calories restriction as CR. So which one is better and why? So no disclosures for this talk. But we really come to a junction where it's, literally we keep asking what came first, and we keep asking whether, calories restriction is better, or is it time-restricted eating that's better? And better for what? Better for weight loss, better particular diet. Why do we need different things? Why doesn't just one formula work for all, or just the same formula keep working for the same person at different times? So first of all, there is a series of compensatory changes in biology as well as behavioral determinants of body weight. That's one reason. The second is that there is an adaptive thermogenesis, which means there is a reduction in the resting energy expenditure, and there is a lot of difficulty in maintaining weight. So you can't have the same strategy working throughout, and that needs to be, you need to shift gears, you need to modify from time to time. And definitely the ultimate aim is to improve weight loss as well as maintenance. So coming to what is really good for weight loss or for better cardiometabolic health, it is literally a physician's holy grail. Coming to intermittent fasting, of which TRE is a subtype, that just simply means eating within a specified amount of time. Fasting diets may or may not involve reduction in the intake of calories during the non-fasting times. So again, just going into some more detail, TRE or the time-restricted eating is a subtype of intermittent fasting, which also everybody knows has become very popular now. And it's a regimen that calls for a set window of time for eating and fasting within, say, a period of 24 hours. It's a very creative and a completely doable method of treatment for obesity as well as other metabolic diseases as well. And calorie restriction overall, or CR, is just reducing the overall calories throughout the day. Usually that entails 20 to 40% of the daily caloric requirement and other subjects. But there is a downside to caloric restriction as well. People are perpetually hungry when they keep following a continuous caloric restriction diet. There is reduced body temperature leading to cold intolerance. There may be other side effects like diminished libido and an adaptive decrease in the total energy expenditure. I think that becomes one of the most prominent disadvantages. And of course, adhering to this kind of a regimen where calories are constantly restricted is a very, very big issue. Because of this, clinically there may be lightheadedness felt, or constant fatigue and tiredness, or even constipation, decreased bowel movements, electrolyte imbalance, patients may be dehydrated, there may be dry skin and even hair loss. And each of us have probably faced this with our patients who are trying to lose weight or in a particular program with us from time to time. Now the CR diets, They are traditionally shown notoriously for low long-term success rates. And the number one reason is that either people abandon it within the first few weeks or days itself, and or even the long-term adherence is a huge problem with these kind of diets. It's estimated that only 20% of obese individuals are actually successful at long-term body fat reduction, which is defined as losing at least 10% of your baseline body weight and maintaining this for at least a year. Intermittent fasting or TRE, which is, we already defined that, and there may be just largely, there are many regimens that come under intermittent fasting, but largely we call it whole day fasting, or whole day fasting as in maybe every alternate day there is, out of schedule of say 7 days, maybe 2 days you are fasting for 24 hours. Then you have alternate day fasting where one day you are eating ad libitum, but the next day you are restricting to 25% less calories. Alternate day fasting, that's something that is also being done. And then there is daily intermittent fasting, which exactly is TRE, because that involves maybe 16 hours of fasting, 8 hours of that eating window within a 24-hour period. Or again, 14 hours fasting, 10 hours eating window, so on and so forth. However, within this window itself, again there is early TRE, which means that you start eating earlier in the day. You start with a breakfast and end maybe by 5 p.m. And then there is delayed or mid-TRE, which is again you start in the afternoon at 2 o'clock. You start your eating window at that time and then finish by say 8 p.m. or so. So these are the different schedules, but I just wanted to make you, understand by and large what we mean by TRE, which means that within our 24-hour period we are restricting the calories or we are restricting the eating window. So intermittent fasting we already talked about, the alternate day fasting or the alternate day modified fasting, or even the 2-day per week fasting window, or even periodic fasting periods. And time-restricted feeding is more specifically the ETRE or the MTRE, which is the mid-TRE or the time-restricted feeding or time-restricted eating. What are the advantages? Well, first of all, it eliminates the need to keep tracking the caloric intake and count during the eating window, making it much simpler and more convenient for our patients to follow. And principally, it synchronizes with the circadian rhythm of the biological clock of the body, where the feeding and fasting cycles synchronize with the light and dark circadian rhythm, and thus it enhances the metabolism and causes weight reduction as the energy homeostasis is maintained between the periphery as well as the CNS communication internally. Disruption of these rhythms affects weight management and other metabolic processes, as we know from many other studies. In terms of the evidence of benefits, intermittent fasting, the form of alternate day fasting, has been consistently shown to have significant weight loss in as early as 3 weeks. In the 5:2 models, which is 5 days, the person is eating ad libitum and then fasting for 24 hours twice a week, most trials again have found weight reduction in all the subjects. And in the daily intermittent fasting studies, daily small feeding windows, that is either 2 meals per day, skipping one of the meals, it again has found to produce significant weight reduction than eating throughout the day. So there is evidence of benefit. But there are certain misconceptions about intermittent fasting, and this is the proof for the same. First, the first misconception that patients often have is that there is decreased metabolic rate, but we know that the total energy expenditure is dependent on the total caloric intake as well as the changes with the macronutrient intake and not with the meal frequency. So that's to be understood, and the patient needs to be guided accordingly. The second misconception about TRE is that there is hypoglycemia or low blood glucose levels. Again, it has been seen that in healthy subjects, even in healthy subjects, not just patients with diabetes, but in healthy subjects too, short-term fasting periods of up to 24 hours do not lead to another intervention where the caloric restriction was up to 1200 calories per day for 7 days per week, and this was done for 5 weeks altogether. They found that the intermittent fasting group lost significantly more weight than the standard group or the calories restriction group, and there was also greater body fat reduction. And it was just surmised that probably adherence was an issue with the calories restriction. So they concluded that if the intermittent fasting group achieved significant weight loss and body composition improvement compared to the calories restriction group, it is believed that that protocol really had some adherence issues. And next we look at a systematic review of 2020, looking at intermittent fasting and weight loss benefits. And they found that all the 27 trials that were included in this analysis, all of them had at least weight loss of 0.8 to 13% of the baseline body weight with no serious adverse events. Doing anything, it can start with a simple walk, or it can be a mixture of both aerobic as well as anaerobic exercises, and we keep building on the same.
I think we do not have enough time for more questions.
One question regarding any changes in the medication in a diabetic patient. Supposing the person is on insulin or on a drug.
Absolutely.
How do we change in TRE?
That's one of my slides had that line also, that we have to be extremely careful. Those on glucose lowering agents like sulfonylureas or insulin, they have.
Well, moving on to the next session, which is